Good day. We are the level 2 students and this is the video presentation for community health nursing. And to start, this is the health nursing care plan for the Laresca family of Malibay, Pasay City. Surveying of data was gathered on Tuesday, 29th of November 2022 with informant Marilu Laresca. Community health practice is the application of science, experience, and many other disciplines to safeguard and improve health within communities. The individual health of each community members affects the general health of the community. This would demonstrate our lifestyle and how we care for both the environment and ourselves. When we talk about community health, we are referring to a field of research in the medical and healthcare studies that place a greater emphasis on communities and groups of people than it does on individual members. It is a different area of study that might be taught in a public health or environmental health institution. It is a field of study that is interested in discovering and enhancing biological communities' health-related traits, according to Palipedia. Community health generally focuses on local areas rather than people with similar qualities. When developing an action plan to enable the community to study the features of any particular area, house-to-house visits and interviews are done to see the health characteristics of a community and find a way to do something about it. As we have seen from Mrs. Laresca's home upon our interview and visitation, the area was quite unwelcoming and complicated. It was strange to see the level of living they maintain, though we keep an eye on things that affect their quality of life, like their environment, and of course their family's education, employment, and religious beliefs. However, we have ways to make a room for growth since community health strives to help a community protect and preserve the health of its members. The structures and systems that characterize the community, as well as by assisting everyone in making healthy decisions with the help of community health nurses. What do we mean by community health nurses? Public health nursing is what it has always been, but community health nursing adds a particular concept of community which can be defined in a variety of ways. It examines community nursing needs and preferences as well as the actions a nurse can make following an assessment to support complementary healthcare and prevention, including support for maternal and child health and many more. Community health nursing is left as an activity for us students to help us better people's way of life and deliver a nursing care plan to those in need. Now let's move on to family. Family is a broad notion that includes a variety of aspects of life, such as the responsibilities of being a parent, siblings, and friends. Healthcare professionals can concentrate on family-centered care or offer a family-friendly environment for care when they are aware of various family configurations. Traditionally, a family is made up of a group of individuals who are connected through blood, relationship, or adaptation. Consequently, this concept is constrained when evaluating a family's health issues or the availability of its social support because some families are constituted on unrelated couples and at the different stages of life, not all family members may live together. However, with the help of community health nurses, the family is the co-facilitator of its own care. This can be accomplished by having a thorough and comprehensive nursing healthcare plan where initiatives are made specifically for a particular family. And now for the rationale. The purpose of this study is to really make observations and provide ideas to those who have been residing in low-density areas, urban areas. This is an approach that organizations like the WHO or the World Health Organization support for dealing with various issues in rural and urban communities in various barangays. We are confident that our study will revolutionize health education, offer a respectable baseline of care, and provide valuable advice to the whole community.
Regarding the statement of objectives, the general objectives is to provide a better understanding of the importance of accurate health information and also to provide or demonstrate changes in the sanitary practice of the family. And also, the specific objectives is to educate the family regarding the difference of beliefs regarding health information, which will emphasize the importance of accurate and reliable health information, and to provide education of the importance of sanitation within and outside the household and possible risks that accompany poor sanitary practice. Methodology and tool used. The researchers utilized home visits and interview methods using structured questionnaires in collecting information from the family. Home visits are used to observe and assess environment of the clients to provide appropriate and accurate healthcare plans. Aside from this, to collect the desired information from the client, the interview method used is specifically structured interview questions. The interview method is one of the most used approaches in obtaining thorough information about the client in connection to providing person-centered care. In connection with this, the researchers used a structured set of questionnaires and possible answers were created in advance. The methodology and tool used in gathering information are deemed effective in completing the necessary information needed in creating a family nursing care plan. The limitations of the study focuses on the environment and health practices of the client and her family and has a potential limitations in collecting data. The limitation of the study is a limited time in interaction with the family. Researchers were only given 2 weeks to observe the family. This may hinder the data collection through observation and may implicate difficulties in achieving the long-term goal of the family plan or the family health plan for the family.
Community in general. Barangay 158 is approximately 23.3 feet above sea level. It is led by Honorable Alicia C. Orhas. The barangay consists of houses that is surrounded by commercial buildings. The barangay is also located near the Estero de Galina. The household of the barangay in Barangay 158 is 195 households as of 2015 census with an average of 4 members per household. The population of Barangay 158 as of 2020 census is 961 people. The age group of the Barangay 158 as of 2015 census is 118 people, which ages 20 to 24 years old. The median of the ages are 26 years old. That means that the half of the population is above 26 years old and the other half is below 26 years old. The barangay hall, there are also barangay hall, barangay health centers, and barangay outposts located near the barangay and the Pasay City East High School, which is a public high school that is located near the barangay. There are also churches like Iglesia ni Cristo located near the barangay hall. Most of the people communicate with their mobile phones with each other using their mobile data services. There are also people with um, internet, their own internet in their households, but most of the people use their mobile data services. Uh, the people in the Barangay 158 are acquainted and they are also uh, very kind, they're very polite, accommodating, and they know their neighbors really well. The common type of transportation in the barangay are pedicabs, motorcycles, and tricycles. There are also taxis and jeepneys, but due to the lack of space in the streets in the barangay, the drivers are having a hard time going in and out. But if you go out on the major highway, you can also see the taxis, jeepneys, and buses. So if you want to travel further from Barangay 158, those are your choices. Meralco is their main source of energy, but their streetlights are solar powered. There are also CCTV cameras that are pointed in the streets, and there are also CCTV cameras surrounding the entire barangay. The barangay hall states that the barangay garbage disposal is separated or segregated by garbage collectors. The streets are swept by street sweepers to maintain its cleanliness. However, the estuary that is beside the barangay hall is dirty and it has a strong foul smell. Most of them uses a water supply that is provided by Maynilad, but there are still some households who still uses water pump and wells.
So the Loresca family is an extended family which is headed by Marilu Loresca, born in Makati on February 1972. She is single parent and her children have different fathers, but however, she did not marry any one of them. Marilu is a 45 years old and she did not have any educational attainment since she had never been to school. She is currently working as a dispatcher at Makati and she currently lives in Malibay, Pasay for 15 years with her family. And as a dispatcher, she earns 9,000 Philippine peso per month which she claimed hirap na hirap kami sa pera. And Marlon Loresca is 17 years old and has only finished grade 9 due to financial problems. He has not been able to continue studying. He is currently working as a painter with a salary of 12,000 pesos per month. And next to him is Mary Ann Loresca, 13 years old, and has already stopped studying. Mark Anthony Loresca is 12 years old and is currently in grade 7. And next to him is Mary Jane Loresca, 9 years old, currently in grade 1. And the youngest among the children of Marilu is Jenna May, who is 5 years old. Her grandchildren Lindy Jane is 9 years old and Joy Joy, who's 6 years old, and both were abandoned by their mother. And Marilu was the one who stands up as a mother for her grandchildren. A healthy environment means a healthy human. Disease risk can be decreased by it. We can lower the danger of contracting disease if we are environmentally conscious. It encourages living a long, healthy life. If for maintaining healthy, we need safe, supporting environments because our health and happiness are significantly influenced by the environment which we live. So the house of the Loresca is found along the road of E. Rodriguez, surrounded by apartments and owned houses and different establishments. The base inside the house, which serves as its bed, dining area, and living room, as well as the elevated part of the house, are both made of wood. And the exterior structure of the house is a makeshift construction made of patched iron and wood. There are apartments, a car workshop, and an open area behind the home, which a few automobiles are parked. The house is beside the Estero Galena, which is filled with garbage and somehow serves as drainage for the residents' used water. Now, this may have an impact on general health. Disease and health problems that water pollution can cause include waterborne disease such as cholera, typhoid, and malaria. And residents besides the river are also prone to dengue as there are many stagnant waters nearby. Now the house is small and they can barely move inside. There is a living room that also serves as their bedroom and has a television and storage boxes for clothes, and on top of it are the paraphernalia. Now their house has an elevator that which you can climb through using a ladder, and that elevated part serves as another bedroom for her kids to sleep. But due to crowdedness, the two other child sleeps outside on the jeep and that was parked in front of their house, and in their kitchen, on the other hand, you can see a little compartment containing some kitchen tools, ingredients for cooking. So the family does not have any direct water supply inside their home. So they have to walk for about 5 meters outside their home to fetch water from the communal faucet while their drinking water is being purchased. The water supply they use for daily consumption is stored outside their home in drums and water containers, but this area is observed to be dirty. From the outside area, it can be seen that some water containers don't have cover, which can cause pollution, especially from mosquitoes nesting. Upon going inside their house, it can be seen that it is very tiny. Upon entering their door, there you can see a small apartment filled with some kitchen utensils, cooking ingredients, distilled water containers, and other bathroom items. The cooking utensils are put behind the door, which is a dirty place to put a kitchen knife, but meanwhile, behind their door is where they cook using a gas stove, and beside that is where they sleep. Now, inside their home, they have this wall that has a TV on it, and below are some containers which they put their clothes, and on top of that, they put their paraphernalia. Beside the door, they have an elevated part that can be climbed using a ladder, and there you can see that another space they also use to sleep. They have a shared level 2 bathroom. The flooring of their bathroom is a plain cement, but the walls are made up of tiles halfway and cement with yellow paint halfway. Now, the family only flushes their toilet manually, and they do have a proper sewage for the used water. They wash their dishes and clothes outside their house on the spot where they also fetch water and use the water, and the used water is directly dumped into the river beside it. But sometimes they experience water loss for 2 to 3 days.
Lifestyle and health behavior. Lifestyle is the way of how an individual lives in his or her day-to-day basis. When we came to the house of the family, we immediately observed or immediately noticed that they have a poor personal hygiene and poor sanitation inside the house. So their houses is rented for 2,500 per month, and they have no proper water service. In the morning, they are only eating biscuits for breakfast, and most of the time, they are only eating for 2 times a day. The children also verbalize that biscuit lang po ang kinakain namin palagi. So they don't have a refrigerator, so they have to stock their foods in tumblers. Their mother goes to work every day, so she only has 4 hours of sleep each day, and she's leaving her children with her son Marlon, who is 17 years old, who works as a painter, and also verbalized that 600 ang araw niyan. In order for them to sleep properly, two of the children needs to sleep outside in the jeepney parked outside their house. Their laundry area is also their sleeping area due to lack of space in their house. They are stocking pail of water outside their houses to use it for their laundry. Whenever they are sick or they are not feeling well, they rely on the traditional hilot, because when the children are given uh, medications, they spit it out and they verbalize, pangit po kasi ang lasa.
Now let's proceed to the health problems that we have seen on the family. The first health problems that we have seen is first poor personal hygiene. Nursing problem, inability to practice proper hygienic care due to a lack of resources for keeping things clean and improper sanitary care practices. Supporting data cues, subjective, mahal na kasi yung tubig, madami kami kaya nagtitipid. As verbalized by Mom Mary Lou. Objective, takes a bath once a day with minimal use of water, does not change clothes often due to lack of clothes. The children were seen with dirty fingernails, and the family members has a strong foul smell. Last is children do not perform hand washing after playing outside. The data was identified on November 29, 2022, and it was not resolved, but they realized the importance of practicing proper hygiene. The next health problem is the faulty eating habits. Nursing problem, inability to make decisions with respect to taking appropriate health action due to failure to comprehend the nature of the problem. Supporting data cues, subjective, yung mga bata kasi di mahilig sa gulay, mahirap pakainin. Ma'am Marilu claims. Objective, family members eat junk foods bought in a sari-sari store. Family members does not eat at the right time because of busy schedule. And last, children does not like to eat vegetables. The data was identified on November 29, 2022, and it is not resolved, but they realized the importance of eating proper food.
Health problem, accident hazard, sharp object. For the nursing problem, the family was not capable to offer a home setting that is supportive of human growth and health maintenance due to insufficient family resource such as financial resources and physical resources. And for the supporting data cues, Mamarilu claims na nung kailan muntik nang masugatan yung anak niya sa yero habang naglalaro. Wala din kasi silang pampayos ng bahay para mapalitan yung mga yero na dingding. And for the objective, the walls of their house are made of rusty iron or yero walls. And the house is so small, they can't even move comfortably, and they are prone to getting bumped in the excess or pointed iron walls that were seen in their house, and it can harm their children while they're playing or moving. And it is identified on November 29, 2022, and it's unresolved. However, at least they understood the importance of accident avoidance.
C. Accident hazard sharp objects. Criteria, nature of the problem. Computation is 3 over 3 times 1. Score 1. Justification, the problem is health deficit. Modifiability of the problem, 0 over 2 times 2. Score is 0. Partially modifiable through intervention and health teaching, but other factors like the environment hinders or affect the success in totally modifying the problem. Preventive potential is 1 over 3 times 1, score is 1/3. Future problems cannot be easily prevented because of the house structure and location, which appear to be not modifiable. However, interventions will make people become aware of the threat and will educate them on giving first aid, which can lessen the risk of injury. If it not prevented, future accident may occur. The salience of the problem is 2 over 2 times 1. Score is 1. People know that it's a problem that needs immediate attention. Total score is 3 over 1/3. Next is D. Impaired physical mobility and inadequate ventilation. Criteria, nature of the problem, 3 over 3 times 1, score is 1. The problem is health deficit and requires more immediate intervention. Modifiability of the problem is 0 over 2 times 2. Score is 0. Partially modifiable by intervention and health teaching because other factors like environments hinders affect success in totally modifying the problem. Preventive potential is 1 over 3 times 1. Score is 1/3. Future problems cannot easily be prevented because of the unavailability reconstruction of the house due to its place, financial matter of the family, and the location, which appears to be not modifiable. However, intervention will make people become aware and properly arrange their things and save space. If not prevent, possible is suffocation. Next is salience of the problem is 1 over 2 times 1. 1/2 ang score. People know that it is a problem, yet not much attention is given. Total score is 2/1/5. Deficit knowledge. Criteria, nature of the problem, 2/3 times 1. Score is 2/3. Justification, it is a health threat. Modifiability of the problem, 1/2 times 2. Score is 1. Partially modifiable through intervention and health teaching, but other factors like the environment hinders and affect the success of totality modifying the problem. Next is preventive potential, 3/3 times 1. Score is 1. The salience of the problem, 0/2 times 1, 0. Justification, the family does not recognize the existence of the problem. Total score is 2/3. Family problems according to priority rank, health conditions and problems score. Rank 1, poor personal hygiene. Score is 3/2. Rank 2, faulty eating habits, 3/316. Rank 3, accident, hazard, or sharp objects, 3/1/3. Rank 4, impaired physical mobility, inadequate ventilation, 2/1/5. Rank 5, deficit knowledge, 2/2.
So, hi, I'm Alberna Sereno, and today I will be discussing the health problems, including the nursing problems, supporting data kiosks, and the data whether when it is identified and if it is resolved or not. So the first health problem that we have observed during the duty in the community is number 1 is the accident, hazard, sharp objects. Nursing problem, inability to offer a home settings that is supportive of human growth and health maintenance due to the insufficiency of family resources such as physical and financial resources. So supporting data kiosks about this nursing problem is subjective. According to the mother or the head of the family, it is verbalized by the head of the family that nung kailan muntik nang masugatan yung anak ko sa yero habang naglalaro. Wala din kasi kaming pangpaayos ng bahay para mapalitan ang dingding. So, objectives are the walls of their house are made up of rusty iron or yung yero po ay merong mga kalawa. And then number 2 is the house is small, so they are prone to get bumped in the excess or pointed iron walls that were seen in their house can harm the children when they are playing. So nakita po namin doon na sa sobrang sikip ng mga bahay, may mga sharp objects na kung yung mga bata ay naglalaro, pwede silang masugatan, pwede silang magkaroon ng injury dahil doon. So, we gathered this data November 29, 2022, and it is unresolved. However, they were understood that the importance of accident avoidance. So, kasi po, unresolved po ito dahil nga with financial matters, hindi naman natin agad-agad sasabi or mai-recommend sa star family namin na lumipat sila ng bahay or maipaayos yung bahay kasi nga po with financial matters. So number 2 naman is impaired physical mobility and inadequate ventilation. Nursing problem, inability to move purposefully within the physical environment, inability to perform tasks within the house environment due to limited spaces. So nakita po namin doon sa bahay nila is masikip. Kaya yung kanilang paggalaw ay naaapektuhan dahil doon. Tsaka meron din po kami nakita doon na yung mga gamit nila sa bahay is not properly organized po. So for the supporting data kiosk, subjective, it was verbalized again by the head of the family, which she claims that mahirap gumalaw kasi masikip. Yun po yung kanyang sinabi. And for the objective, we observed that inadequate space inside the house for the rest of the members of the family. The house is so small, so they are prone to injuries when performing tasks as instructed. For example, the door is made up of yero. So if they actively move, they might get injured. Moreover, some of our equipments inside the house are hanging to save spaces. So yun nga po. Dahil po doon ay maaari po silang ma-injured, maaari magkaroon ng mga aksidente na hindi namamalayan. Especially when it comes to kids kasi they are hindi pa sila gaanong yung sa kanilang galaw, hindi sila gaanong kumbaga hindi nila nakokontrol yung kanila pong mga galaw. So, we gathered this data November 29, 2022, and for the if it is resolved or unresolved, it is unresolved. However, they understood the importance of having proper mobility. So, it is unresolved po kasi nga po is hindi rin namin marirecommend kasi nga when it comes to financial problems din, hindi namin marirecommend na lumipat sila ng bahay kung saan mas makakagalaw sila ng maayos. So, instead of that, nagkaroon na lang kami ng health teaching about kung gaano ka-importante yung mobility, lalong-lalo na sa mga bata at sa matatanda. And the fifth one, or the next health problems, is deficit knowledge. Nursing problem is insufficient knowledge due to the lack of healthcare accessibility. So, the supporting data kiosk, subjective, it was also verbalized by the head of the family, which is, bihira lang silang magkasakit. Pero pag sila ay nagkakasakit, pinapahilot lang sila hanggat hindi malala, ay hindi dinadala sa health center. So, objective data, they are not concerned about their health. They are already satisfied with the health that they were nakukuha sa mga manghihilot, or in the more formal way, it was called Dr. Quicker. Yan po. So, the data were gathered November 29, 2022, and if it is resolved or not, it is unresolved. However, they understood the importance of seeking help from health professional. So, it is unresolved because I think dahil nga dun sa paniniwala nila, their beliefs and culture na rin as a Filipino, na di ba nga po, kumbaga noon kasi hindi pa naman masyadong maraming mga doctors or health centers, kaya parang mas nasanay po sila na magpahilot na lang, mag-ano sa kung ano man, pero we help them naman to understand the importance of seeking help from the health professional. So, ayun po.
So, FNCP or Family Nursing Care Plan. So, our FNCP or our Family Nursing Care Plan, our group developed 5 of it regarding po dun sa 5 problem prioritization. And number 1 is poor personal hygiene. Nung nag-interview po kami sa community and bumalik, after malaman na sila yung Star family, we have observed that the mother has the inability to maintain mental and physical health due to knowledge deficit about the importance of personal hygiene, lack of personal hygiene routine, limited access to personal hygiene supplies, and risk for infections and decrease diseases due to uncleanliness. Yun nga po, no, after namin sila nakita namin yung mga bata naglalaro sa labas, then after nila maglaro, hindi sila gumagas ng kamay or naglalaba. And then, minsan po, due to limited financial or personal hygiene supplies like yung sabon, minsan ginagamit nila yung shampoo nila as sabon na rin. And lack of personal hygiene routine, ayan, hindi naman nagugas ng kamay. Tapos, naririnig rin naman po sila, pero minsan, pag umaalis yung mother, it was verbalized na yung mga bata lang iiwan and hindi nag-guide ng mother kung naliligo ba sila or hindi. So, our group's goal of care is that after teaching, the mother will be able to know the importance of practicing the good hygiene, good personal hygiene, and the benefits they can get from it. And the objectives were to teach the children proper personal hygiene, provide their own personal hygiene materials, so that dahil alam na nung mother yung mga importance, is ang goal namin is mabilan niya yung mga kailangan gaya ng mga panghilod, ganyan, and mga sabon, kasi iba pa rin yung kaya niyang linisin kasi siya shampoo, hindi naman kasi siya for germs talaga. And C is to know how to prevent such the infections to occur, kasi nga po bihira lang sila magugas ng kamay, mga bata naglalaro from the community, tapos diretso kain, hindi nagugas. So the nursing intervention is to broaden the knowledge of the family, especially the mother, about the importance of maintaining proper personal hygiene. And number 2 is to discuss the benefits they can get, the advantages and disadvantages. Well, walang disadvantages sa paglilinis ng maayos, or meron yung time consuming, pero a little sacrifice na rin po, no, for their benefit. And number 3 is to teach how personal hygiene prevents such diseases to occur. So, to be specific, ililesson natin yung mga possible na infections na makuha nila from the community to themselves. The method of contact is home visitation, visual aids, transportation, time and effort, and personal hygiene kit. So, number 2 is faulty eating habits. Napansin po namin during the interview, they have a possible malnutrition due to risk for malnutrition due to faulty eating habits. So, dito napansin po natin yung mother, she verbalized na they have the ability to provide enough food conducive enough to help maintain health dahil wala silang pera. Twice a day lang kumakain yung mga bata and hindi pasakto sa oras. And tinanong ko po what time sila, nung tinanong ko ano yung gusto or mahilig kainin ng mga bata, the mother said na ang gusto lang nila is yung biscuits at kape, lalo na sa umaga. So, yun, they have limited financial support, and the mother has knowledge deficit about the importance of eating healthy foods 3 times a day dahil hinahayaan niya po mangyari yun. And parang it was observed na rin na hindi niya gaano kaalam yung mga healthy foods na kailangan ng mga bata or healthy nutrients na dapat makonsume nila sa isang araw. And then, since they are all kids, like school-age kids, they have a picky taste buds and limited food supply. Though malapit na yung market at may katabi silang sari-sari store, hindi pa rin, kulang pa rin yung source po doon ng food nila. So, ang goal of care namin is after teaching the mother will be able to know about the basic foods, recipes that are child-friendly, yung masarap po para sa kanila, pero affordable, healthy, and within the budget. So, our objectives are to distinguish the healthy for the mother, to distinguish the healthy food for her kids, come up with a healthy meal plan that is within their budget, know the right time to eat, and then know the importance of eating 3 times a day. Kasi po, twice a day lang sila kumakain. So, the nursing intervention is that to broaden the knowledge of the family about the importance of eating properly 3 times a day. Ano po, paalam natin sa mother kung bakit kailangan ng mga bata na kumain 3 times a day, especially breakfast, kasi hindi sila nagbe-breakfast dahil ang mga bata ay tulog pa raw. So, ang nangyayari, yung lunch nila, yun na rin ang nagiging breakfast. And that's not how it is, kasi nga po, alam naman natin yung mga bata, naglalaro sila, kulang sila sa energy and all. And number 2 is to discuss the importance of nutrients and vitamins the children need. So, kailangan ng mga bata yan, lalo na ngayon, na may pandemic and all, at kung mapapansin naman po natin sa community, yung smell, and then yung dating is, alam po natin na kailangan talaga nila ng immune system doon. And number 3 is to share a child-friendly recipe that is healthy and within the budget. Like, i-share po ng group namin yung knowledge namin about sa mga food, like, for example, vegetables, talong, na hindi mo mapaghahalata ang talong siya. So, wala pong problema kung papakain natin sa mga bata. And our method of contact is home visitation. And then the resources required are just visual aids, transportation, and time and effort. So, the third one is the accident hazards. Or, as we've noticed, doon po sa bahay, bukod sa maliit siya, bukod sa sobrang liit niya, is parang ang roof niya, and then walls, are iron roof walls, or yung in Tagalog, yero. So, the family nursing problem is that the family has an ability to provide an environment friendly for kids dahil una, the electrical wirings are just there, malapit sa bahay, nakakalat. It's not maayos, like it's very faulty. And letter B is that pointed sharp objects are around. Like, for example po, yung mismong roof walls nila, iron roof walls, though merong mga kahoy na nagsistand as pillar, andun pa rin po yung risk na matusok sila nun, and like, risk for tetanus din, if ever na masugatan sila, and improperly kept hazardous objects, like, yung mga foods and mga sabon or iba pang gamit, panlinis, nakahalo po, magkasama. So, there's a possible contamination and possible rin na ma-ingest yun ng mga bata whenever magutom sila if hindi sila na-educate ng maayos. So, the goal of care is that after nursing intervention, the family will be able to have enough knowledge to take extra precautions, extra safety precautions about the possible hazards around the house or around the area. So, the objectives of care is that after the nursing intervention, the family will be able to be knowledgeable about the hazardous objects around them, na hindi lang po yun basta-bastang kinikip or nandyan. Kailangan meron talagang safety precautions and to have extra precautions about it. And to keep the hazardous objects na hiwalay dun sa food. And, yun pa. So, the nursing intervention will be discuss different alternatives, courses of action, provide information to the family about the importance of keeping everything in place, especially the consequence of failure to comply, and then help with child-proofing and labeling of hazardous and non-hazardous things for possible ingestion. So, yun po. Ang method of contact is home visitation, and resources required is transportation, mga panlinis, mga child-proof tools, gloves, and visual aids na rin po for their knowledge. Na papakita po natin yung mga pictures and yung possible symptoms na makuha nila from that accident hazards. So, letter D is risk for physical immobility. As I've mentioned earlier, their house is so small for 8 person. And parang tuwing natutulog po sila is hindi sila nakakagalaw. As in, ganyan. Tapos, yung nakakulubot ba yan? Parang, yun pa. So, the poor environmental status of health threats such as inability to move freely due to enclosed spaces, hindi po sila makagalaw, and the goal of care is that after nursing intervention, the family will be able to take necessary measures to prevent the risk for physical immobility. And it is also a risk for your mental health, since kailangan talaga natin ng safe space, lalo na sa loob ng bahay. Our objective of care is that after nursing intervention, the family will be able to tell the importance of having enough space inside the house and decide on what to do about the organization of their house. So, our nursing intervention is to broaden the family's knowledge about the importance of enough space, the organization na rin po, and to encourage na i-organize yung bahay so that the kids will have a place and they can move freely around the house, though maliit lang siya. Kasi iba pa rin po talaga yung may safe space ka sa labas. And yung dalawang anak niya is sa jeep lang natutulog, which is very risky, lalo na sa panahon ngayon, marami ng masasamang loob na pag natulog sila sa labas ng bahay, doon sa jeep, baka mapagtripan sila and all. So, ang method of family contact is home visitation, and then the resources required to just transportations, visual aids, and then, time and effort. So, the last one is the deficit knowledge of the mother. So, when it comes to deficit knowledge, they have a knowledge deficit related to nursing care because it was verbalized by the patient po na hindi sila nagsisik ng healthcare advice or hindi sila pumupunta sa mga health centers, hospitals, and such dahil yung mga limited yung financial support. Ang nagtatrabaho lang po is yung mother and yung panganay niyang anak, which is 17 years old lang. And then, possible family nursing problems or possible medical complications due to insufficient knowledge about the health problems, lack of knowledge about illnesses and diseases, na possible na meron na pala yung mga bata. Dahil pag nagkakasakit sila, hindi sila dinadala sa health center. Instead, nagpapahilot lang sila. Unless malala, saka lang nila isusugod. So, the limited access to medical supplies and medicine and risk for serious complications dahil walang daily check-up yung mga bata. And the goal of care is that after the nursing intervention, the mother will be able to know the importance of seeking help from medical professionals to treat when sickness arises. So, though medyo may kaunti pera ilalabas, mas importante pa rin naman po, goal namin is mas ma-realize ng mother na importante pa rin kahit papano, kahit minsan na mag-seek ng medical advice from professionals. So, nagbe-base lang po kasi siya sa mga haka-haka or paniniwala before, mga paniniwala nila before, like yung hilot or kapag nagkakalagnat, alam nila paracetamol lang. And yung ibang mga bata is hindi raw po sila umiinom ng gamot din. Dinudura talaga nila. So, mas maganda may support ng mga doctors kasi alam nila kung ano yung i-reseta based sa taste buds or sa palate ng mga bata. and objectives of care. After the intervention, the mother will be able to learn the basic things to do when her children get sick, such as go to the nearest clinic or hospital, and to seek medical advice when it comes to illnesses and not just rely on cultural beliefs. So, yun nga po, nagre-rely lang siya sa kung ano yung alam niya noon or kung ano yung ginagawa sa kanya nung parents niya noon. So, the nursing intervention will discuss the benefits na makukuha niya doon. Also, hindi rin naman natin itatago na there are some disadvantages, pero mas malawak pa rin yung advantages na mabibigyan nito, and to encourage to seek medical advice from professionals. So, yun po. The method is that family contact, and the resources required lang naman po are visual aids, transportations, time, and effort. So, yun lang po for FNCP. Health teaching will be reported by Estefa Dalay.
Good day. So my part is to share what we have come up for our health teaching with the title, The Roles of Environment to Physical Health. So our health teaching plan is for the family of Mrs. Marilu Loresca with the objectives. After the nursing health teaching, the family will be able to improve the mental and physical well-being of the family, know access to safe and nutritious food, be knowledgeable about safe space and how it affects physical health. And for the contents, the advantages of choosing a lifestyle. First, discuss some do's and don'ts when it comes to picking foods. Second, promote healthy low-budget meal recipes. Third, discuss the importance of having enough space within the house. For the strategies and activities, we've come up with oral recitation about the topics discussed and a short quiz. For the learning resources, we have a pen and paper and a PowerPoint presentation. For the evaluation, we have decided to have a oral recitations and active questioning. That would be all for our health teaching plan. Thank you.